All right, so this session is going to be recorded. So if anybody does not wish to be recorded, you can turn out your video at any time. But we do highly encourage you to turn on your video because this is an interactive discussion. We want to make sure that we're feeling like a community. So if you can turn on your video and you're comfortable doing so, go ahead and do it. I'm going to kick it over to Dara Purvis, who is going to introduce our very, very special guest speaker this evening, Congresswoman Schakowsky.
Hi, everyone. I'm Dara Purvis. I'm a professor at Penn State Law and a member of the board of directors of the Population Connection and Population Connection Action Fund. And I'm so thrilled to get the chance to introduce Congresswoman Schakowsky to you, although I doubt she needs much introduction. She represents Illinois' 9th congressional district. She's represented that district for 12 terms. She serves in House Democratic leadership. She is the senior chief deputy whip, serves on a number of extremely important committees. But from my perspective, at least, and I think from many of our perspectives, we appreciate her long advocacy and commitment to women's issues in Congress, particularly the fight to protect reproductive freedom. So she has a long history of really being on the front line of the issue. She is an original co-sponsor of the Global Her Act. She is the lead sponsor of the Abortion is Healthcare Everywhere Act, which was introduced in the House last week on International Women's Day. So I am just thrilled to hear from her. It's a great honor. And Congresswoman, the floor is yours.
Congresswoman Schakowsky, you're muted.
There we go. Sorry. Thanks, Dara, and I'm so happy to be with all of you. What a great gathering you have. I know you have a wonderful panel that's going to be coming up, and I am just thrilled to be able to talk with all of you. So I do go way back. I go way back before Roe v. Wade. I'm from Chicago, and one of the things that happened in Chicago was Jane. It was really an underground network of women, run by women, to find safe abortions for women, even when abortion was illegal. That doesn't mean, though, that I didn't have friends who risked their lives quite literally. And I like to say that Roe wasn't the beginning of women having abortions. It was the end of women dying from abortions. And so that's my beginning. Fighting for Roe and finally winning that, but it didn't take long before the antis began their attacks. And so the Hyde Amendment came shortly after preventing any public dollars whatsoever, any federal dollars from abortion services. And now we have the Each Woman Act that Barbara Lee and I introduced a number of years ago to just get rid of the Hyde Amendment once and for all. And of course, we also have a promise that it will not appear in the appropriations bill. The chairman of the appropriations bill, Rosa DeLauro, said, no, we're done with having Hyde in there. And then, of course, there was the Helms Amendment. And I don't know, somehow it is as important as other bills, but I didn't really know about it until fairly recently. The Helms Amendment, Jesse Helms, a racist, and of course he was happy to deprive countries with women of color in particular from having federal funding that would come from the foreign affairs money, could not go, first it said, to any country that would use abortion as family planning. But then it morphed into any country that would do abortion for any reason. And so I have introduced Abortion is Healthcare Everywhere. I like the name of that bill because I like having the word abortion in it, because we are standing tall and proud and strong. And then, of course, there's the global gag rule. So we want to repeal the Helms Amendment, but the global gag rule, you know, its history. There's a Republican president, and they impose a global gag rule on any organization, any NGO, even with their own money, that would dare to have abortions over anywhere outside the country. I mean, really. And then we get a Democratic president like we have now, who on, I think it was the first or second day, said, no way, we're going to get rid of the global gag rule. Well, now we have the Global Her Act that we need to pass that says we're not going to fight that fight anymore. We're just going to get rid of the global gag rule altogether. So we're, you know, we're moving along on this agenda. So I want to tell you, I think in some ways, this moment in history is both the best of times and the worst of times. And I want to talk about the best of time, be optimistic first. Women are mobilized more than I have ever seen, and fierce. I love it. And we are a pro-choice nation. Yes, we are. The majority of Americans believe that women should have, that it should not be for politicians to decide, it should be for women to decide. Now, there are levels of, you know, support for abortion, of course, with all kinds of exceptions in some places. But in general, we have a pro-choice country, and we definitely have a pro-choice House of Representatives. And that's why these bills are going to pass. And then they're going to go to the Senate, and then we have to deal with the filibuster. And here's the worst of times. We have a Supreme Court that is 6-3 anti-choice, 3 appointed by Donald Trump. But I want to tell you something, and I'm going to perhaps end with this. You're going to have to, you know, do something to tell me when to quit here. Women are not going to go back. I want to say to you, my sisters, I don't know what exactly that's going to look like, but we are simply not going to go back. I think that we will have OBGYNs who are going to say they're not going to start serving their patients. I think we are going to have demonstrations like you've never seen before if they were to dare to repeal Roe v. Wade. And by the way, there's a new bill that has passed in Arkansas, hasn't gone into effect yet, that would essentially end abortions. And I think what the antis want is that for that bill to go to the Supreme Court. And so we have to be geared up to do whatever we need to do to create an environment that we can live in, that is safe, and that will deal with our reproductive health. I also just wanted to highlight, again, I want you to cut me off when you need me to. I believe in discipline here for meetings like this. I just wanted to tell you the legislative principles for the pro-choice caucus that we have, which is one of the biggest caucuses that we have in our Democratic House of Representatives, passing clean funding bills free from any and all harmful anti-choice riders anywhere, to make sure that that doesn't happen. To increase funding for critical domestic and global programs, including Title X and teen pregnancy, et cetera. and of course, internationally. And then 3, eliminating funds for abstinence-only education and sexual risk avoidance programs. So we also have 16 bills. I mentioned some of them that are on our agenda that the pro-choice caucus is going to, I'm one of the leaders of, is going to be pursuing. So really, the last thing I want to say is states. We have to watch what's going on in states, because too many of these states are dominated by Republicans, and they are doing everything they can to make our reproductive health, to punish Planned Parenthood, to punish any of your organizations and the work that you're doing. So we need to be partners every step of the way. We need an inside strategy, that's the pro-choice caucus in the House, and an outside strategy, that is you and all of the organizations that are fighting for reproductive health. We need to be coordinated. We need to plan our activities together to make sure that the timing works and that the language works. We don't never want to introduce anything that, you say, oh, I wish it would have said this or that. We have to be together as close as we can be. So I just thank you for your advocacy, for your research. I know that Guttmacher has provided all kinds of information, has told me that if we do the Helms Amendment, we'll prevent 42 million unsafe abortions, will prevent them, and that we will save thousands of lives. Guttmacher, thank you. I know that we've got Ipas on your panel. We have the Center for Health and Gender Equity. I wish I could stay. I have to go vote, but I just send you my love. I want to send you as much strength as all of us have together, and that is plenty to do the job. So thank you, thank you, thank you.
Thank you so much.
Congresswoman, thank you for joining us. I know you do have to go vote. Do you have a couple of minutes for a couple of questions, or do you need to run?
Do I have time for a couple of questions? Yes, I think.
Okay, wonderful. So we would love to know what are the prospects for the Global Her Act this year? We know like this is the year to get this done. Like what are the prospects for getting it done, and what can our participants here do to help push this piece of legislation through?
Okay, you have to target members of the Senate in particular, and I'm sure we will also produce a list. There may be some in the House that need to be bolstered and need to hear from you. So that's the main thing. And the message to the members, senators or House members, needs to come from the district. So we need to be mobilized around their districts. The second thing is, for many of the bills that we are passing now that are not done with reconciliation, where we only need 50 votes, we're going to have to do something about the filibuster, about the requirement, the undemocratic requirement for 60 votes. I mean, think about it. The Senate itself is not especially democratic when, California and Utah each have 2 senators. And then you add insult to injury with requiring 60 votes. So we're going to have to do something. And I'm encouraged because we've heard both from the president, and we've heard from senators that there's, some movement in that direction. But you need to think about mobilizing your members collectively in all of the states so that members of the Senate and the House hear from their own people. Those are the important things to do. How long? Oh, I've got 1 minute.
Okay, well, we will let you go. We don't want to make you have to jog down to the floor. So thank you so much for joining us. I know this was a tremendous honor for all of our constituents and people here to hear from you. We appreciate all the work that you've done over the years, and we look forward to continuing to work with you on.
Thank you so much. I send you love and strength.
Thank you so much.
Okay, good night. Okay, let's see how I'll let somebody else get me off. I can do that. Yes, I see a sign here. I can get off.
Awesome. I want to hear in the chat, what did you all think of Congresswoman Schakowsky? Tell us some of your thoughts. We are so happy to have such an awesome champion working on our issues. Obviously, the Congresswoman's a busy person, so she had to start right at the start. So I wanted to take a little moment now to kind of reset and give you all some more information about tonight's event. My name is Lindsay Apperson. I use she, her pronouns, and I'm the National Field Manager of Population Connection and Population Connection Action Fund. And we're really excited to have you here today for our 2021 Digital Capitol Hill Days keynote event. You just heard from Congresswoman Schakowsky, and we're also going to hear from some other really incredible speakers tonight for our panel discussion, including Maria Antonieta Alcalde Castro, who is the director of Ipas Central America and Mexico, Zara Ahmed, who is the associate director of federal issues at the Guttmacher Institute, and Serra Sippel, who is the president of Center for Health and Gender Equity. So we're really excited to enjoy this panel with you all. I'm loving all of the excitement in the chat tonight. Before we jump into our conversation, I also want to cover a few housekeeping items. Please keep yourself muted while the speakers are talking to avoid any audio interference. And then you can feel free to drop questions in the chat for our speakers. We're going to be covering those questions at the end. We've also taken steps to make sure that this is a safe space, but there's always a chance that we could have online trolls who try to interfere with the event. If that happens, we'll pause the discussion. I'll put up an image on my screen until that person has been removed, and then we'll start back up with our discussion. So now I want to kick it over to Dara Purvis, who is on our board of directors of both Population Connection and Population Connection Action Fund, who is going to start off with a couple words before we kick it off to our panel discussion.
Hello. So I don't know if it's easier if you were thinking a Q&A, or I can just talk about abortion rights, which I'm very, very happy to do.
Talk about abortion rights. That's what we're here for.
Great. So I gave myself a very, very quick introduction if you were here right at the beginning, because I knew Congresswoman Schakowsky was in a rush. So again, I am Dara Purvis, pronouns are she, her. I'm a professor at Penn State Law, and I specialize in gender and sexuality in the law, reproductive rights, assisted reproductive technologies, and a lot of things in that space. And so I can talk for a few minutes about sort of the state. Congresswoman Schakowsky referred to sort of the threat before the Supreme Court right now to abortion rights and reproductive rights more generally. So I thought I could talk for just a few minutes about sort of where we stand before the court. And I will preface my remarks by saying that I am a lawyer, so I am obliged to be cynical and pessimistic. So I apologize for what will probably sound a little bit negative, but I am very concerned with what is going to happen before the Supreme Court. All of you are very engaged in this issue, so you may be pretty familiar with kind of the lay of the legal land. But to kind of remind you of where things stand, Roe v. Wade established clearly the right to abortion as the right to privacy as a constitutional right in 1973. But basically since then, it's been under attack from a variety of theories and with a variety of techniques. And in particular, we've seen the membership of the Supreme Court shift considerably towards a much more anti-abortion perspective. So Roe v. Wade set out what is no longer used, but was a trimester framework of understanding abortion rights, where in the first trimester, the pregnant person had, pretty complete control about whether to terminate the pregnancy or not. Second trimester sort of balanced the rights between the pregnant person and the state's perceived interest in unborn life. And then in the third trimester, that state interest kind of took over. That shifted considerably. The test changed entirely in Planned Parenthood of Southeastern Pennsylvania v. Casey in the 90s, which very nearly overturned Roe v. Wade. We now know from some of the justices' papers that were released years after the case that the initial vote was to overturn Roe v. Wade. But some centrist justices sort of came to a compromise to at least keep the core of the abortion rights stable. But they created what's known as the undue burden test. So if a regulation or a limitation on access to abortion creates an undue burden in a person's ability to choose to terminate their pregnancy, that violates the Constitution. Otherwise, it's an appropriate expression of the state's preference, which they held the state can express against abortion and in favor of what the state views as unborn life. Now, what that did was it kind of opened the floodgates to a lot of smaller restrictions in the first trimester that never would have been allowed under the initial Roe v. Wade framework. So the one common approach became what's known as TRAP, targeted restrictions of abortion providers. So it's restrictions that on their face don't seem particularly significant. They may not immediately appear to be a really direct attack on the abortion right. So it'll be something like, we want abortion clinics to follow the same kind of building code requirements as ambulatory surgical centers. So you might not read that language and think to yourself, this is really an attack on the core abortion right. But what that would do is require every clinic that provides abortions to basically redesign the entire building, meet some very burdensome requirements that all sorts of other medical facilities that perform procedures much more dangerous than abortions, with higher risk to health and to life, that they don't have to meet. And the idea is this is going to make it harder for clinics to provide abortion care. This is going to make it harder for women to access abortions, for people to access abortions. So there has been a sort of slow inching narrower and narrower towards people's realistic ability to access abortion care. And one of the most recent cases, Whole Woman's Health from just a few years ago, was really kind of one of the first rejections of these TRAP restrictions. So this was the statute in Texas that Wendy Davis famously filibustered for hours on the state floor. It had a couple of requirements, the ambulatory surgical center requirement that I mentioned, and then it required that any doctor performing abortions have admitting privileges at a hospital, which can be very difficult to obtain because abortions are so safe that you very rarely need to interact with the hospital at all. And typically there's a requirement that you admit a certain number of patients each year to have these kinds of requirements. And for the first time, the Supreme Court said, when we are assessing whether something is an undue burden, we're going to ask whether it benefits people seeking abortion. Because previously they had just said, is this a strong enough, is this a high enough burden placed on someone seeking an abortion? So once they said, will this actually benefit the patients, the people going for abortion care? They said the answer to that is clearly no. There's no evidence that these measures will do anything to provide better medical care for people. It will shut down most clinics in Texas. And it will make it much harder for people to safely seek abortion care. So this was a little bit of a watershed. This was very promising. But then, as all of us know, Justice Ginsburg passed away and left the court. And we are faced with a bench that looks pretty strongly anti-abortion. So there was one case last fall, last summer, I should say, June Medical Services, where unusually Chief Justice Roberts crossed the aisle and voted with the justices who we would think of as more progressive to strike down an abortion restriction. But it was an unusual decision because the restriction in question was exactly the same restriction that the court had already struck down in Whole Woman's Health. And so Chief Justice Roberts wrote a concurrence, but it's basically it has the power of the opinion of the court to say, I'm striking this down because no one raised the underlying constitutional question of whether there is a right to abortion under the Constitution. And because no one has asked that, I'm bound to follow our previous precedent. And that precedent is clear. But hey, if anyone were to bring a case before the court that actually said Roe v. Wade should be overturned, that would be an entirely different question. And right now in state legislatures throughout the country and in lower courts throughout the country, you have people and advocates trying to get that case before the court. So Congresswoman Schakowsky mentioned a bill in Arkansas that virtually outlaws abortion in all circumstances, that it's hard to see it as anything but a frontal assault on the right to abortion and Roe v. Wade. So it's my prediction that we're going to see a case that explicitly asks the court to overturn Roe v. Wade in the next term, maybe in the next 2 terms. And the prospect for that case does not look good given the membership of the court as it stands today. So it's more important than ever, even though we have these exciting opportunities for legislative action, it's more important than ever that we be prepared for what's coming, because we may be in a situation where we're, seeing the legal groundwork that we've had for decades potentially taken away from us. And the legislative and the popular action is going to be more important than ever. Oh, and I'm looking in the chat questions. I'm not good at talking and reading at the same time.
One question, do you think there's any hope for changing people's views on abortion, therefore increasing the likelihood of pro-abortion laws?
I do. I've seen this just in the students who I have, who I've talked about abortion with. So one of the statistics that I don't think people are aware of, and I've seen it change the mind of my students in front of me, is that the majority of people seeking abortions already have children. These are people, deciding how to best form and support their family. I think there's a lot of mischaracterization and kind of demonization of people who seek abortion care in a way that doesn't reflect, who these people are. These are people that already, and they're making decisions for very understandable reasons. And surprisingly, despite a lot of work to try to raise that awareness, somehow I think it just hasn't taken hold in the way that I think it should. Because I've seen that be very persuasive for people, sort of realizing that their picture of who seeks abortion care, it just doesn't correspond with reality.
Thank you so much, Dara. We really appreciate your time and that really wonderful grounding reminder of the moment that we're in with the courts and our own fight to expand access to abortion care. I think especially as we talk about policies like the global Gag Rule and the Helms Amendment, it's really important to remember that all of these attacks are stemming from the same exact place. I'm going to now kick it over to Stacey Murphy, who's our Director of Congressional Relations, who will be moderating today's panel.
Hi, everyone. I'm very excited to be moderating the panel. As Lindsay mentioned, my name is Stacy Murphy. I use she, her pronouns. I'm the Director of Congressional Relations for Population Connection and Population Connection Action Fund. I'm going to invite our panelists to be pinned up here along with me so we can all be looking at each other. There's Serra, Zara, and Maria. Okay. So I'm going to let all of them introduce themselves, and just part of the first question, I'm going to ask each of our panelists to introduce themselves, tell us a little bit about your organization and the work that you do, and then in keeping with the title of this session, tell me what is your vision for bold international reproductive health policy under the Biden administration? Who wants to go first?
I can go first, Stacey. I'm, with a Z name, I always have to go at the end. So I will take my
Let's flip it up.
Go first this time. So hi, everybody. I'm Zara Ahmed. I use she, her pronouns, and I lead U.S. foreign assistance and foreign policy work for the Guttmacher Institute. The Guttmacher Institute is a research and advocacy organization that focuses on sexual and reproductive health and rights at the international, federal, and state levels. So I put out a piece last month that lays out our vision for sexual and reproductive health, and it's namely a world where everyone has access to the full suite of sexual and reproductive health and rights. The piece also talks about how the U.S. should contribute, and it's a complex piece, but at the bottom line is that the Biden-Harris team needs to take 4 key actions. First, re-engage and lead on the world stage, and they've started doing that. Second, move the U.S. towards paying its fair share for global health. Third, address outdated and coercive policies, chief among them being the global Gag Rule and the Helms Amendment. And lastly, rebuilding the technical, programmatic, and diplomatic capacity of the U.S. government. I'll stop there, but just want to say how happy I am to be here this evening with you all.
So alphabetically is your turn, Sarah.
Okay, so hi everyone. So glad to be here. I'm Sarah Sippel. I'm president of Change, the Center for Health and Gender Equity, and we are here in Washington, D.C. And we were founded in 1994 to hold the U.S. government accountable to the commitments it made at the 1994 International Conference on Population Development. So we are here in Washington, D.C. Our mandate, our responding to the call from our global partners after ICPD to go home, take care of our own government. And so we take that to heart. And so that's why we're here to really push the US government to fulfill its commitment to the global agenda to promote universal access to sexual reproductive health and rights. And just some exciting things, I think, in terms of when we're thinking about bold action from the US government. We've already seen within the first 50 days of this administration, 2 executive actions, a presidential memorandum and an executive order that states that it is US policy to support sexual and reproductive health and rights in the US and globally. This has been a long-term goal of change in many advocates, so and it's historic and unprecedented. And then I also want to note the US delegation to the UN Commission on the Status of Women this week, a historic delegation that really is demonstrating this administration's commitment to diversity, equity, and inclusion. It was the first time the US was represented at the White House level at the CSW, and the first time 2 women of color co-led that delegation. And the diversity of the members of the delegation itself really show the administration is taking an intersectional approach to gender equality with the inclusion of a non-binary transgender woman, Lourdes Ashley Hunter, as a member of the official US delegation. So I just kind of wanted to flag those 2 really important benchmarks and say that the government, this administration is off to a good start. It's just a start, has a long way to go to be taking bold action, but I think it's really a call for us on advocates to push them. They've signaled they're ready for bold action. So just in conclusion, what would bold sexual reproductive rights agenda of this administration look like? I think it would be one that really adopts a reproductive justice framework. So that would be that all policies and programs protect and promote bodily autonomy, takes an intersectional approach, centers the lives of those who are most impacted by US policies, and dismantles the racist and neocolonial policy structures and systems of our US foreign assistance. So I have big plans, vision for this administration. I don't know if we'll get it done in 4 years, but I think we're off to a good start. And I'm delighted to be here because we need all of you to help us make that a reality. So thank you.
Great. It's hard to go after Sarah and Serra. I'm Antonieta Alcalde Castro. I'm director of Ipas for Central America and Mexico. I'm here on behalf of Anu Kumar, who's the director of Ipas, but couldn't make it due to a conflict in his schedule. But I'm really, really glad and happy to be here. Ipas is an international nonprofit organization. We work across Africa, Asia, and Latin America to improve access to abortion and contraception so that everyone can determine their own future. We know that this is a fundamental right, and that when women can actually decide over, when we can decide over our sexuality, the whole community benefits. We believe that abortion is health care. We are convinced that it shouldn't be like it's like an imposed agenda that is this controversial when it's a health care service that is actually non-dangerous for women, that you can actually have in your own place. So that this whole rhetoric about making it very controversial, it's part of another agenda that doesn't have women at the center of it. We have very high hopes, as Sarah and Serra were talking. I think that the entire world is looking at the Biden-Harris administration right now after the past 4 years with the Trump administration, of course, were had a huge impact in the US, but it also had a huge impact worldwide when it comes to women's rights. And Sarah was mentioning the Commission on the Status of Women at the UN. And I had the opportunity to work very closely at many UN negotiations, and the impact of the US policy was huge. We have never seen something like that. The US coming very strongly, harassing, bullying other countries to join their agenda. Really trying to please the most conservative groups with things that were nonsense. This idea of for example, pick and choosing human rights, saying these are real human rights, these are not human rights, things that we have not seen, and things that were embarrassing for the US people who had fought so hard for a human rights agenda, with every administration. You can have but we have never seen anything that what we saw with the Trump administration. So I think that the entire world is looking right now at the Biden and Harris administration, say, you have a long way to go just to get things right. Just to get to the point where we were 4 years ago. But we have further expectations in terms of really putting women in the center of your agenda. And I think that we're seeing good signs, but there is a long way. And we think that it's important to start as fast as possible and as hard as possible. So I would stop.
We could all go on for a while with what we would like to see over the next few years. So let's talk about specifically the global gag rule and how your organization or how your work was impacted by the Trump reinstatement and expansion of the global gag rule. Where there were impacts, are those ongoing, even though we've seen the rule rescinded? And in your opinion, how long is it going to take to actually get those impacts going the other direction?
I could start now, so we can go the other way. From my experience working internationally in reproductive health and reproductive justice for many years, really the global gag rule had tremendous impact. The US is a big player on the sexual and reproductive health field. and it really affects a lot of communities. And I mean, as you know, the global gag rule, I think that it's clearly a very ineffective policy, even for people who cares about the reduction of abortion services. It had been proven that that it's not effective to reduce the need of an abortion. And I think that Congresswoman Schakowsky was already saying, like, this discussion, I mean, like, these type of policies are not about like abortion yes or not. It's about making abortion safe or unsafe, because women are will need these services regardless. So first, I think that what we have seen, it's very ineffective. It has put women in a very challenging situation where like their own provider cannot really provide them with a comprehensive service that they need, like in many places. And I think that like that's why the name, the global gag rule, because it had really gagged organizations and service providers and had put it like service providers in very difficult positions where they have to decide between giving the information and the services that their patient needs or keeping their doors open. So it's like, it's really unfair. So it's, and at the same time, it's ineffective because we know that it doesn't reduce the need of abortion. We know that the only thing that renews, or the few things that renew the needs of abortion, is access to contraceptives, comprehensive sexuality education, and improve the conditions of women, where maternity is not a kind of a something that hinders the possibility of women to develop. I mean, those are the real things. Like I always said, like if you care to reduce the need of abortion, invest in family planning, like access to contraceptions, comprehensive sexuality education, and like and ensuring that maternity and motherhood is not hindered, like the possibilities of women to develop. So we know that it is a very imperialistic policy and very disrespectful to national laws, because basically what it says is, regardless of like if you actually have the right to abortion services in your country, in your own context, I will impose my own view. So women that actually have the right to access abortion in their own countries, in their own communities, are denied of those informations because this country in the north is imposing its view. So it's very colonialistic, very imperialistic. And most of all, it's a very cruel policy, because it's like it's impacting the most vulnerable women. The women that are served by these organizations are the ones the most in need. A wealthy woman in Nicaragua, in El Salvador, in Mexico, can fly to the U.S. and have access to safe and legal abortion, or pay their own physician in their own countries and have access. Are the women living in rural communities, the women the women who are indigenous women, the ones that are affected. So what we have seen, it's very, as I said, inefficient, imperialistic, and cruel. And the challenge is that organizations are in fear. And I mean, of course, they need the resources to provide the services they need. So many times, like what has been challenging between this repealing the gag rule and they're imposing the gag rule, and with every change in the government in the US, is that at the end it creates this stigma around abortion that it's very dangerous and like kind of like prevent, again, physicians and organizations like this fear to work on an area where we know that abortion is health care. It's just a service that an amazing number of women need during their reproductive life. So beyond being ineffective, imperialistic, and cruel, it contributes to the stigma. So even when it's have been repealed by a democratic government, we see that it's really hard to change the entire kind of like bureaucracy to suddenly be more progressive. And at the end, even if it's changed, we stay kind of in the middle. So that's why it's so important to repeal it once for all and stop this kind of a cruel game between parties, between repealing and imposing. Repealing and imposing, where like at the end are women in the field and the most vulnerable women who are affected by this policy. It's a very cruel game.
Yeah, Thanks, Maria Antonieta. And absolutely, the cruelty of it, cannot be underestimated. And I think for change, with Trump being elected, just as soon as he was elected, and Mike Pence being his vice president, we knew right away that the global gag rule, of course, is going to come back. But we did suspect that it was going to be even worse, and it was. They expanded it to across all global health. Whereas previous iterations only applied to international family planning. So for change, our work was greatly impacted, obviously, from the expansion. Immediately, we created two new mechanisms. We had a legal working group that we put together of lawyers and counsel at advocacy and the implementing organization groups to really explore strategies for legal strategies to mitigate harm. So while we were fighting to we wanted it repealed, but that's an act of Congress. As long as it was in place, we needed to find ways and think creatively through the law on how to really to grapple with the expanded policy and to mitigate the harm in real time over the past 4 years. And similarly, we brought together researchers into a global gag rule research group, because we also knew that, well, we need to document, and starting on day one, what is the impact? But we also wanted to make sure that we were coordinating, sharing methodologies, but also that we didn't want all of a sudden everybody doing research going to Kenya or to Uganda, and needed to make sure geographically we spread out, one, to get better research and data, but also we didn't want to inundate the groups on the ground who are already dealing with this horrible policy, and then on top of it, to be responding to all these research requests. So those were two ways we really had to organize ourselves differently that we've never done before. But most importantly, as Maria Antonieta was talking about, it's the impact on the people's lives, on our partners. And I'll give a few additional examples. In 2018, one PEPFAR partner in Eswatini had to close all of the voluntary medical male circumcision services in its district. The facility had provided 42% of the district's voluntary male circumcision services in 2017. So those were completely wiped out because of the global gag rule. It shuttered successful PEPFAR HIV prevention programming, ended advocacy relationships because groups who were taking US funding felt like they couldn't work with those who weren't taking US funding that were working on abortion. People lost their jobs. Clinics had to fire people. They had to end youth employment and youth outreach programs, a reduction of cancer screenings, gender-based violence services, and it disproportionately impacts LGBTQI communities because they get a lot of their services from reproductive health family planning clinics are also serving LGBTQI communities. And then also we saw also people with disabilities being impacted. So the people, and just want to stress, that the people on the ground were really impacted in ways that, we document some, but it's just so much more. And I know Guttmacher has done really in-depth research on this as well. And it's devastating. And I think that's why it's so important that it just has to end completely once and for all.
No, thanks, Sarah. Yeah, we've done a lot of research and documented impacts on at least 5 levels, and I'll put a link in the chat here. And the 5 levels being impacts on people seeking care that we've just heard about, impacts on healthcare providers, impacts on implementing partners, impacts on public health systems. So with fewer community health workers being able to go out and provide door-to-door services, and then impacts on foreign policy and how this has undermined the US's standing overseas and relationships with other organizations. And Stacey, you asked a question about how long it'll take to undo these harms. And I've heard some people talk about the gag rule as a light switch that flips on and off. And I don't think that's a very good analogy. I think it's much more accurate to call it a really slow, inefficient dimmer switch. So yes, you can bring the light back, but it's going to be slow and there's always going to be kind of a shadow looming. So the point is that it's going to take years to get partners back into the fold, to rebuild capacity, to get patients and providers to trust each other again and trust the US government, and to get other countries to truly believe in us. But as Sarah said, frankly, none of that is going to happen 100% until the global gag rule is gone for good.
So all of that leads really closely into my next question, which is, we saw from the study in the Lancet recently, and I'll go ahead and explain that for the people who are watching who aren't familiar with the study from the Lancet that we all know so well. There was a study from the Lancet that looked at the effects of the global gag rule, the previous version during the Bush administration years, which was a less expansive version than the one we saw under the previous administration. And they found that for the 10 sub-Saharan African countries most impacted by the gag rule, the ones who lost the most US support, their abortion rates actually increased by 40% during that time period. And so the rates of maternal injuries, the rates of unsafe abortions, the rates of all of those sort of negative impacts. So given that it takes so much time to do that sort of wide, in-depth analysis, I mean, how long do you think it will actually be before we know the true impact of the most recent expanded version of the global gag rule? And what do you think a study like that, Lancet, I mean, I understand that that's asking you to sort of project, but, given your expertise and what we saw under that earlier version, what do you think that a similar study would show?
I'll get us started. I mean, I think a similar Lancet study would involve exploring the impact of the policy on more than just contraception and abortion. An updated study would most likely include impact on a range of SRHR, sexual reproductive health and rights issues, especially around HIV and LGBTQI people. I think there's a lot more data that we need on that. And I'll find the link to a fact sheet that Change has put together with that lists the various impacts that we have to date. But I think it's important to recognize also how hard civil society and other donors work together to mitigate the harm of the policy. That most publicized is the She Decides, which successfully stepped in for some larger organizations in some regions, specifically around family planning access, contraception access. But activists and advocates also work tirelessly to try to share information and reduce the harm of the policy at a scale not seen before. So that means like just making sure that people understand where it applies or not applies, the confusion between Helms and global gag rule, but also where are some workarounds. I mean, the global gag rule does have exceptions for rape, incest, and life endangerment, but a lot of people in countries receiving funding don't realize that and think they can't not do anything related to abortion. So that's what I mean by mitigating harm is helping people. You have this policy, but what are the workarounds? So we have and we'll have more data on the harms, but it needs to be understood in this context of harm mitigation. And also useful to remember how wild this conversation is right now, talking about the harms and focusing on the harms. No one, including 3 different US government reports, allege that any good health come out of this policy. We're only ever talking about the scope of the harm that the policy causes. We don't talk about any good that comes out of it.
Yeah, and Sarah, just to add to that, that the State Department must have tried to find something good to say, and they couldn't even find something good. All they could say is that the policy did harm to HIV programs, tuberculosis programs, nutrition, water and sanitation. The Trump administration's own State Department had to confess that publicly, which tells you just how bad it is. And I really want to underscore a point that Sarah made, that there's been absolutely no documentation of a single benefit, a single public health benefit, political benefit perhaps, but no public health benefit to anybody from this policy in any iteration. And to your question, Stacey, the Trump administration expanded the global gag rule not once, but twice, and tried to do it a 3rd time on the way out the door. So we know if the baseline was bad, that this vast expansion is going to be much, much worse.
Yeah, and I think, like, I mean, just to add on that, what I was saying before, is like, I mean, this policy is really ineffective. I mean, it doesn't produce any good. Even for people who have in their heart the anti-choice agenda, they were not able to prove that actually reduce the need for abortion. It's just make it like harder and unsafe for women. And I think that like the Trump administration's implementation of the policy was like kind of like this global gag rule on steroids, like really like growing in every direction. And it's going to be hard also. I think that like we saw the report on the Lancet, and we, I mean, we were not surprised because we saw it, but like you can really tell the impact that like we can multiply that for 10 for the global gag rule under the Trump administration, and things that we may not even know. Like, I mean, we work very closely like on a case, for example, like where like Pro Familia Colombia, like an organization that provides comprehensive sexual and reproductive health services in Colombia, including abortion, because in Colombia abortion is legal, and they were about to sign an agreement with USAID to provide basic services to immigrants from Venezuela, like people coming from Venezuela to Colombia under, humanitarian assistance settings, and they were not able to start that work because the Trump administration came in power and they had the global gag rule. And so I think that the expand in terms of like this was migration, humanitarian services that were not even starters. So I think that like the impact will be huge between what Serra and Zara were saying in terms of the program that has to be shot, the services that were not provided, but also it was expanded. So everything frozen, even things that were really fundamental, like working on humanitarian settings, on basic healthcare service. So I think, yeah, like, I don't know, 4 years or 8 years from now, when we see that report, we will see the scope. And I think that's why it's also important that the Biden-Harris administration sent a very strong message to all the USAID machinery, saying this is a message. We need to speed up the recovery from these times.
So let's go back and talk a little bit more. Zara, you mentioned the shadow from the dimmer switch. So let's talk a little bit more about why we need to pass the Global HER Act, and why and how that the risk of the policy coming back, how that inhibits progress, and what that does to clinics. So why is that such a problem? A little more detail about that, please.
Sure. So when it's in place, the gag rule puts providers in an impossible position. Agree to these ideological terms or forgo the money. But when the gag is not in place, it also puts providers in a bind. Agree to come back into the US fold and undo everything you just did and know that it's all going to be for nothing in a few years, or stay away and try and scrape together resources. And this is why the gag is so incredibly insidious. Even when it's not actually in place, it still manages to cast this enormous, cold, dark shadow. And frankly, that makes it untenable, because the longer this goes on and the more aggressive the gag rule becomes, the more providers and partners are going to stay away, and the more people who are going to lose access to essential life-saving services. And so that's why we need the Global HER Act, so that the gag can't keep casting this shadow and haunting providers even when it's officially not in place.
Yeah, I think I'll just, to add to that, I think the other piece of this is we have organizations that have just stopped trying to get US funding, and a lot of feminist women's rights organizations. And so it has that lingering, so it's really pulled, needed resources from organizations doing critical work overseas. And so I think these kinds of policies that are, as Maria said, neo-colonial, they're racist, and they really are preventing organizations from doing the work that they need to do. And so it either, shuts down organizations or limits their resources because organizations can't, they can't afford, it's an ethical issue, right? Don't take money if you can't do what your mission is, what your organization is, or follow your beliefs and principles. And that's why it is insidious. And so I think that's an important piece to really remember. It's not just the public health aspects of it, which are absolutely critical in terms of life-saving, but in terms of how we're really preventing people and organizations and countries from living by their conscience and doing what's best and responding to their country's challenges with local solutions.
I couldn't agree more. I think that when you think about like this, as I said, that this cruel game between kind of imposing and repealing the gag rule, I mean, what we see, it's like kind of a bunch of people, like signing a document and say, okay, it's repeal now. Okay, it's imposed again. But kind of what Sarah was saying, kind of this impact, like build again the services that are needed. Like Sarah was like talking about these services that were like shut down, building that again, training the people, hiring the people, getting the trust of a community. It takes years. So it's not something I really like this, it's not like on and off. It takes years. So it's really this game between should I take money from the US, knowing that depending on what happens, maybe in 4 years, suddenly all this investment, I will have suddenly to shut down. It's completely inefficient. And it's, as I said, it doesn't help anyone. So I really think it is so important that the Global Hair Act is passed and to finish this game once for all, and that actually prevents and remove this tool, because it is a political tool. It's not a technical tool. It has nothing to do with the actual issue of abortion, because abortion, again, the need will be still there. So it's just a political, it's a bone that is thrown to a constituency. So remove that bone and remove that tool once for all. And if they want to play with some other political game, that at least those women in the field are not the ones suffering for this cruel game that it's play in Washington. So I think that really the Global Hair Act is fundamental to promote an ethical approach, an approach that is less neocolonialist, of coming from the US. So we're watching.
So I see a question in the chat. It's a good question to ask here. So someone wants to know if the gag rule results in a big bucket of unspent funds, or where does that money end up going? Does it end up going to less effective programs or worse organizations? How does that work when the sort of top providers back out?
It's a good question. I think, Sarah, I'm looking at you too. Largely the answer is no. There might be some delays in diverting to, as you said, less efficient partners, but in some ways the money just gets tied up in less impactful programs.
That's exactly right. And that's part of the problem. And that's actually why some organizations, they really grapple with ethically, morally, they're opposed to it. But they'll take the US money because they don't want it going to organizations that are not qualified, who are actually going to be working against women's and people's reproductive health access. So it really creates those, those dilemmas and just kind of the ethical dilemmas that so many groups are put in. But yeah, as Zara said, it's a matter of, it goes to either less qualified organizations or organizations take it and hold their nose.
So once we've actually passed the Global Hair Act, we're still going to have the Helms Amendment in place. So there's there are layers to this fight. So let's talk a little bit specifically about the Helms Amendment and how it works and what the impacts are more broadly, sort of beyond the gag rule.
Sure. So I can kick us off with this. So first of all, it's really important to understand the difference between the two, since they're often talked about like the same thing. They're not. The gag rule is about telling people what they can't do with their own money. The Helms Amendment tells people what they can't do with US money, which is namely to support safe abortion services. So this Helms Amendment is a draconian policy. It applies even in countries where abortion is legal. So as Maria Antonieta was saying before, it's forcing the US to undermine local health systems, national sovereignty, and meddles in what is a legal health service. And so the failure of the US to support safe abortion contributes to more than 35 million unsafe abortions every year in low and middle income countries. And those lead to 23,000 preventable maternal deaths. So a couple weeks ago, we released a new analysis, and I'll put it in the chat, that shows the impact of the Helms Amendment if it were to be repealed, and if the US supported safe abortion services in the 33 countries where abortion is already legal and where the US is supporting family planning programs. So we found that there would be 19 million fewer unsafe abortions each year, 17,000 fewer maternal deaths each year. The overall number of maternal deaths due to abortion would decline by 98%. There would be 12 million fewer women each year who have abortion-related complications. And then there'd be a cost savings of $641 million. So this is probably an underestimate. This just looks at a few countries, 33 countries. And even if more countries liberalize their abortion laws or USAID expands their work, even more people and communities and countries would benefit. So there's a huge upside to repealing the Helms Amendment as well.
I just want to add to that, you know, at the 1994 International Conference on Population Development, where the US joined 170 countries into this agenda. And while the agenda didn't go far enough on abortion, it did say that where abortion is legal, that countries should make it available, safe, accessible. And so the US government signed that and joined that consensus. And I think it's forgotten largely, and that they committed to supporting countries who were liberalizing their laws where it was legal. So there's really, to have this law goes directly against that commitment, and so I think there's a need to really call into account the U.S. government on this policy that is, again, I'm going to say it again because it's neo-colonial, it's racist, and I think that we have the audacity to go into these countries and tell them that they can't be implementing their own existing laws, or we're not going to help them, or not only we're not going to help them, we're going to actually inhibit their ability to provide these services, and these are countries responding to their local public health challenges, and the US government is just standing in the way, and it's egregious.
Absolutely. And I think that like the kind of one of the big challenges of and why it is so important to repeal the Helms Amendment is because reproductive health is comprehensive. You need to have a comprehensive approach when you have when you provide services and when you have a policy, and kind of preventing organizations and governments from having this comprehensive approach, because they need the resources, but they cannot use the resources where they know is needed. And here we're talking, again, many times we think about this as in paper, but we're thinking, talking about work in humanitarian settings, when we know that many of these women sadly has suffered from sexual violence and maybe facing an unwanted pregnancy, and that they need, as part of the basic healthcare services, to have access to abortion. And organizations working on humanitarian healthcare setting having to struggle and kind of deal with how to be able to provide these without pissing off the US that has this policy that actually kind of have this broad interpretation, when the actual text doesn't necessarily of the Helms Amendment doesn't necessarily said that, but has this overall interpretation that no money coming from the US should ever be used on abortion. And it really, again, it's creating no good, but it's creating a lot of harm. So I think that that's why the Abortion is Healthcare Everywhere Act is so important. And I was like Representative Woman Schakowsky was talking about, like, I really like that it has the word abortion there in the title of the bill, because it is important that we do our best to reduce the stigma around abortion. And every time that we kind of shy away and not mention abortion, we're doing that. So I think it is important that this pass again, like to repeal the global gag rule once for all, but then also to go to the root with the Helms Amendment to ensure that actually the US can implement a comprehensive foreign policy, a really comprehensive on sexual and reproductive health and rights.
So how do we work together as a global community to get rid of these current policies and prevent others from being imposed? What can we do as a global society?
Well, I think that it is important to call it out. I think that like all the campaigns, the research that is being done, like sadly, I mean, we live in a very polarized world, and we are seeing, like, I mean, we have like the Bolsonaros in Brazil, and we are seeing these type of governments who have a very regressive policies, who are very like populist and trying to be closer to these to the anti-choice movement, not only in the US, everywhere. And it is very important to work together, organizations. I mean, like the organizations that we're here now, Change, Guttmacher, Ipas, that we work on the same field, but we complement each other in terms of research, advocacy, service provision, technical work. We need to tackle these from every angle. I think that it is very important to support the mobilization, the movement. I mean, we just saw it in Argentina, how, I mean, a very vibrant women's movement, very young, took the streets and changed the law. They were defeated 2 years ago in the Congress, and then they took that like sadness and frustration from the defeat and like bring it again. And it is very important when we talk about the gag rules and the Helms Amendment, kind of the center of the conversation is service provision. What I mean, because these regulations are about abortion service provision, but we need to have a comprehensive view when it comes to abortion, because service provision, it's one element. If we put in the center that woman that is facing an unwanted pregnancy, and we look at all the elements that facilitate her decision to terminate that pregnancy or that obstruct the possibility of make that decision, the availability of the services is one component. But you also have, as I've been saying, stigma. The stigma is huge, and many women do not access services, do not seek for services because stigma. There's like the community support. There is, of course, the law, the regulation. So I think that one element that it is important that we working as a community is to be able to look at this issue from like what we call at Ipas, an ecosystemic view, like a comprehensive view, and we are able to invest in all the areas. And we hope that from the US government and the philanthropy more and more to look at this comprehensive view and to be able to invest in services, but also invest, for example, in women's organization in the field that from what we're seeing in Latin America, but also in Poland, in other countries, are the ones holding the ground when it comes to reproductive justice.
Yeah, and I think it's great. And I think following what Maria Antonieta said about, centering the people who are impacted. And I think when we're working in the US, when we're working on these kinds of policies that impact people overseas, people who are in countries that are impacted, really centering them. And I think there's a wonderful saying from the sex worker rights movement, nothing about us without us. And I think we really need to take that to heart. And I think it can help us be bolder as US advocates. And I think taking those the voices, the experiences to members of Congress to really, I think the data and the evidence is really important, but Congress gets to their, you have to get to their hearts and their minds. We get to their minds with the data and evidence, and we get to their heart by really hearing firsthand accounts of what the US government, the impact that we're having on people's lives. I think another piece is to connect US policies and US foreign policies. These are very much separated. There's a false division. And I think we need to be better in the United States about making the connections. I think the Biden-Harris administration, as I said when I opened, that they've already put, it's the policy of this administration to support sexual reproductive health and rights in the US and globally. So how can we as advocates, as voters, as organizations, really align our agendas? I think we'll be so much stronger. I think for so long, it's been conventional wisdom that foreign policy is not a voting issue in the United States. And it's like, yes, that's not going to be how people vote, but it doesn't mean that voters don't care about it. And that's why I love so much that Population Connection has been doing this work, being out across the country, really educating voters about these issues, because we need your voices. We can't, there's only a few of us in Washington that are actually doing this on a day-to-day basis. So we need that mobilization. And I think it's movement building, right? That's what this is all about. And I think as much as we can align with movements around racial justice, climate change, women's rights, sex worker rights, that, in the US and globally, if we can really bring these movements together, again, I think it can be really powerful to make these kinds of policies like Helms and the global Gag Rule, that it's just that people won't stand for it, and that the US policymakers need to really hear that.
Zara, did you have anything to add? Okay, handled. So what are your organizations doing to reassure partners whose confidence has to have been shaken by the last few years? So, how do we reassure them that we've got their backs, that we're trying to fix this?
It's hard to answer that when we just had a coup attempt in our capital, and seriously, our democracy is so fragile. We're not good. We're not the messenger. It's like reassuring our global partners is not possible. What we can assure them of is that there are people in the United States who have their back, that we're fighting for them, that we really, we're going to be here through and through, to put out the fires in Washington, and to be supportive of them there in the country. And so I think that, this is why this time is so important. Over this year is our moment to get rid of this once and for all. And I think our global partners are really counting on us to do that. And so it's really about, I think if we can follow through on our advocacy and have some successes here in Washington, I think that's how we reassure them that they have people in the United States who have their back.
Yeah, no, like I agree with Zara, and being like someone living overseas and looking at what happened in the U.S. from the neighbor in the south, from Mexico, but like in Ipas, most of our work is overseas. I think that there's a lot of concerns about the situation in the U.S. and what happened. Really the 4 years, and I know, from inside, and having lived in the U.S. for a long time, from inside, like these 4 years of the Trump administrations were very challenging, to say in a way. But from the outside, it was really scared. It was really scared to see how quickly things could change, and how bad in terms of the impact that it had. I mean, not only in our agenda, but if you see climate change, if you see migration, like almost like on every agenda, every progressive agenda, you could see like this impact. So I think that right now, what we're doing is like, I mean, like with our partners, like saying that we are working closely with the government, like trying to be closely to the governments to provide this vision from what is happening. I mean, there are so many needs in the U.S. and that like the situation was so critical that like it's really hard to look outside, but like I'm kind of bringing what is happening outside, bringing the reality of what is happening in other countries, and bring it closer to the government. And that's why I think that the Abortion is Healthcare Everywhere Act is so important in terms of like, it's not only about what is happening in the US, but it's also about the impact of the US and how the US is a key player outside. So what we're telling to our partners is like that this is a time to bring these voices, like that we need to work together to help this administration to be successful, because that would be in the benefit of everyone.
I agree with everything everybody just said. And the only thing I would add is that in some ways this is like a relay race, right? You get exhausted if you try and run the entire thing by yourself. We are all going to burn out at some point. So this is also about showing compassion to other partners and saying, we know you have suffered under the Trump administration. Like, I will take up the mantle and push for change now. You were playing defense for so long. Let me play offense a little bit now. So I think that is also about partnership, and why we're all here tonight is about how we pivot and pick up some of that slack now.
So in the interest of time, it looks like we have about 8 minutes left. So I'm going to skip to my last question so that we have a couple of minutes for questions from the chat. What are one or two things that you would suggest that our advocates should emphasize during their Hill meetings in making the case for the Global HER Act, for substantial US investment in family planning, and for support of UNFPA?
Sure. So I would say on the substance, be clear that these investments have a tangible impact on lives saved and healthcare costs saved, but they also have benefits in terms of gender equity, economic development, political stability. And so yes, these investments are the right thing to do, but they're also the smart thing to do. And on the style side, don't be afraid to be passionate and personal. Anyone can recite talking points and stats, but be clear about why you care, why this matters to you as a person. And you will be more powerful and persuasive than any paid lobbyist when you allow your passion and your commitment to shine through.
Yeah, that's absolutely right. And I think just on a, when you're meeting with your representatives, your senators, I think, obviously we want them to support this effort. We want them to sign on to the bill, et cetera. But we also need leadership. That means Speaker Pelosi and Schumer, that we need their leadership on this. So at the end of the day, when deals are being cut behind closed doors, we need them to have our backs. So I think encouraging your members, telling them that we need leadership to support ending this bill, because if it's not the bill, we may get rid of it through another mechanism, which is fine. But again, I just can't stress that enough. And then also just, ending the policy, how it's good in terms of letting countries respond to their own public health challenges with their own local solutions. And the US government should get out of the way of countries, of other governments doing what they think is best for their country when it comes to making abortion legal and accessible.
Yeah, and I mean, if I can add something, like, and I fully agree with Serra and with Zara, like in terms of like how to approach and then like this idea, I really like what Zara said in terms of like allow yourself to be passionate about this and like talk to with your true voice. And I mean, show them that this has impact on real people, that these policies are really real people many miles away, many times from Washington, it's suffering with these policies. And this time, the type of leadership that is needed, like from the US, is a leadership that brings people together, that brings country together. We know in this field and in every field, and there is no way to bring countries together and to create that partnership and support that the world needs if you keep imposing these imperialistic and colonialistic that are, it's like, it's my way, and the way that I see it is the only way possible, that it is important that all US policies respect the realities and the needs of local people. And I think that like bring some statistics, but also bring some stories like about the information that you also know from your community of what happened when women have access to contraceptives, when women can decide on whether to continue or not a pregnancy. I mean, our agenda, it's about motherhood. It's to ensure that no one is forced into motherhood, that motherhood is always it's something that is positive for women. So I think that it's also like, I mean, that talk about your values and your principles and what guides your own agenda. So and thank you from overseas for doing this work. Like, we really need people like you talking to your representatives with the voices of we, the ones who are affected by these policies. So thank you very much for doing this work.
Thank you for that. So I've got a few questions here just really quickly from the chat. A couple of technical questions. Somebody wants to know what's the difference between the Helms and the Hyde Amendment, because Congresswoman Schakowsky mentioned them both. And then what are the biggest gaps in reproductive health funding right now?
Yeah, so I'll take really quickly the Helms Hyde one. It's confusing. The Helms Amendment applies to US foreign assistance funding overseas not being able to be used for abortion. The Hyde Amendment applies domestically, and it says US funding cannot be used to support abortion domestically. I'll just say, I have a pinned tweet. I get this question like 15 times a day. My pinned tweet is about the difference between the Gag Rules, Helms, and Hyde. So, yeah.
And in terms of your second question, in terms of the gaps on reproductive health, I think like challenging like many. I mean, we don't have sufficient funding even for the basic. When we think about reproductive health, like access to family planning, and I mean, we still need funding for family planning, but abortion is one of the areas that is like, because it's so controversial. And I think that, like, again, there is a reason to make it controversial when actually it's just healthcare, it's a service. But there's very few funding for abortion services, for abortion supplies. So there is a huge need in that area.
All right. So we've got 1 minute left according to the clock on my computer. So I want to give you all the opportunity to, like, any final statements, anything I should have asked but didn't. What do you want to leave our audience with tonight? No one? We covered everything?
I will just say thank you. You're doing the hardest thing, which is to show up at the end of a long day to listen to people talk at you about something that they're nerding out about. And you have stuck with it, all 63 of you. I see you. Thank you. And I appreciate you, because as I said, we cannot do this alone. This is not something that is like a one and done, one meeting, you've got your win. This is a long sustained campaign, and we need every single person. And you may not feel like you're contributing a lot. You do this a few times a year, but it actually means a lot that regular people take the time to show up and advocate on this issue, that it's not a niche thing. So I just want to say how much I appreciate each and every one of you from across the country and across the globe.
Yeah, I would just add my voice to that. As I said, like, thank you for doing this, and I mean, I think that we cover like everything, and for me, it's like the most important is like but it's abortion is healthcare at the end. I mean, at the end, and like the more we do, like to reduce stigma on abortion, the most we talked about it. We have a program in Ipas with other organizations where like we have a site for women to share their own stories. I think that many times we think that abortion is like a service that a few women need because there are so few of us talking about this. But the moment that you start asking your grandmother, your sister, your aunt, your friend, we see that there are a lot of women who have the need for these services. So this is more regular than we think. And talking about this, and again, thank you, because you are, I mean, like we need the US to take this work, and you are the ones who are actually making it happen with your like actions every day and with this type of work. So you have allies all over the world. And as I said before, we are watching, the entire world is watching, and we are expecting great things of the Biden-Harris administration and of this new government.
Yeah, just adding my thanks. And I think just two things. I think one would be, we really need to break down this false divide between US domestic and US global policy. And I think the more that we can all be talking about it, making those linkages for ourselves, for the policymakers, because for too long, I mean, it's the same people making decisions and policies about US domestic policy as it is for foreign policy around abortion, around sexual reproductive rights. So I think it really calling the Biden administration to account. What do they mean by in the US and globally? So I think we can make a lot of progress if we bring these two agendas together. And similarly, the intersectionality of these issues. I think with the one thing that we've learned about the expansion of the global gag rule is it's just so blatant how these sexual reproductive health and rights issues are interconnected and how they come into people's lives. So we can no longer separate abortion and HIV and contraception and maternal health, that these are all people are dealing with these things as single individuals. So I think that's important. So I'm again, thank you to Population Connection for doing this, for bringing you all together. It's so inspiring and gives me so much hope, and not feeling like we're all alone doing this. We need you. And so we're really grateful for you all stepping up and stepping into this work.
Well, thank you all to all of our panelists. Thank you so much for joining us tonight. Everybody in the chat, please join me in a little round of applause for our panelists for coming tonight. This was a great discussion. We really, really appreciate you being here. And to the supporters watching, I just want to say thank you to all of our activists and donors for making this whole program possible. This work wouldn't be possible without your support and dedication. And if you are willing and able to donate to our campaign or would like to get involved in other ways, please do reach out. We're going to drop some links in the chat. And I'm going to kick it back over to, I guess, Lindsay. And thank you all so much for joining us tonight. And we look forward to the rest of the program over the next few days.
Thank you so much, Stacy. I think that's a wrap for our program. If, like Stacy mentioned, Tori will be dropping a link in the chat of where you can support us, whether it be financially or staying involved in our work. We'll be on to answer some questions if you have any outstanding questions from that panel discussion. And thank you all so much for joining us. We hope we see you tomorrow for our next event, which will be at 1 p.m. Eastern time. Thanks. Does anyone still on the call have any questions for us?
I don't know. I had a question. Okay, so when I forget who it was who mentioned, I think it was Dara. She mentioned Roe v. Wade and how the judge gave the dissenting opinion. That's the right thing. Yes. Is that kind of like his signal to the, I guess, anti-choice movement that if they want to get Roe v. Wade overturned, that's what they kind of need to bring up to the table? Is that kind of that was just
That's
a
exactly
signal?
what that was.
I
Yes.
hate him so much. I cannot stand these people.
No, that's entirely what that was.
How
He
evil.
wrote the case for them. He's like, this is what you need to do.
So do you think that was really strategic in the way that he did that?
Yes.
I hate these people. I'm sorry.
Yeah, we don't like him, but he's not stupid.
He's not stupid.
Like he laid it out for him.
Because I couldn't imagine he couldn't have. How would he have gotten the word out otherwise? I mean, I don't think there was another medium to do that. Thank you. Also, I think I'm going to drop off. I don't really know if I can answer any questions, but let me know if I can help in any way.
Thank you.
Bye, y'all.
Just wanted to give Liza, Kevin, Denise, Lana, no pressure, but if you want to ask us any questions, feel free to speak up.
I was trying to listen to the panelists, watch my Skype for questions from the chat, and also block out the fact that I could hear my 5-year-old singing a song about unicorns to herself from upstairs. So
Very impressive multitasking.
yes. We're all unicorns all the time around here.
All right, if there aren't any questions, I think we can go ahead and wrap up. Liza, Denise, Lana, thank you so much for joining us. We hope we'll see you at our next event tomorrow, or the one on Saturday, or the events on Sunday, and then also the events on Monday. So plenty of time to stay involved, and we really appreciate having you all on this call. So see you then. Bye, everyone.
Bye, everybody.